From Microbe TV, this is Q&A with A&V. I'm Vincent Racaniello, and joining me tonight from Chevy Chase, Maryland, Amy Rosenfeld. Hello, Amy.
Hello, Vincent. How are you today?
I'm pretty well, actually. Someone ate the tacos, so I was looking forward to having them.
Well,
I had cacio e pepe.
I was going to say, why didn't you have the leftover cacio e pepe?
Welcome, everyone, to your Wednesday night evening of Virology. And let me thank our moderators, Vanity, Steph, Les, and Tom, for being here again tonight. It's really cool that you do this for us. Amy has had some little computer problems. She's actually tethered through her cell phone right now because her internet's not working. So let's cross our fingers and hope that your cell phone doesn't run out of power, right?
I was working. No, it's connected to my big laptop, but nothing. I don't know. It's just a shit show.
So those
and
of you,
it was perfectly fine when I left on Sunday. It was perfectly fine, and I actually even paid the bill. Now it's just a fucking shit show.
Hey, you can't curse that much.
Too many wires, too many this, too much.
Just relax. Just relax. Don't move so we don't see you breaking up. And I'm sure all we need are your astute answers, okay?
Okay, well, we'll see how that works out.
So this is great because in the old days, the stressed Amy would have blown up at this situation. And you see, now you're so chill that you're smiling, man. Look at this. She's smiling. This is great. What kind of sweater? Is that a cashmere sweater? Someone wants to know.
Yeah, it's a cashmere blend.
Always cashmere, right?
Of course. What do you expect? Just because I left New York, you don't expect me to go, get out, do you?
Hey, Amy, look at this. Amy is worth waiting for. I said we have to wait for Amy. Andrew says you're worth waiting for. Isn't that cool?
That's great.
I predict that.
Is he the one from New Zealand?
Yeah, he's from New Zealand. So just to remind folks, Amy is on Wi-Fi tethered to her cell phone. You have a pretty good cell phone connection there, don't you?
Yeah. You want to know what's ironic about the whole situation?
What?
Is I think my cell phone might be using my Wi-Fi.
I don't know if...
About them apples.
It doesn't matter. Anyway, sit back. Don't move, because when you move, things break up. See, sit back, Amy. Don't look at things.
I'm sitting back.
Are you ready to focus on questions?
I'm always ready to focus on questions.
So, if you don't move, then the computer doesn't have to redo the image all over. See, now you're very sharp. So, all right, let's see what we have here. First question, how does Paxlovid work?
It's a protease inhibitor.
It's a small molecule.
Blocks the active site.
Blocks the active. It goes into this protein. Now, the protease is a protein, an enzyme that cuts up the coronavirus proteins because they're made in long precursors. Excuse me. And they have to be chopped up. And so the protease does that. It's essential. So if you block its activity, the virus does not reproduce. And so that's why it inhibits replication, and that's how it works. So there you go. Works well.
Yep.
Nobody mentioned Fauci. Heard he had Paxlovid rebound. Yeah, who knows what he has. I don't think we're interested in what Fauci has or what anybody's wife or husband has. That's anecdotal information that doesn't help. Do you remember Caroline, Amy, who asked for recommendation from Daniel?
Yes.
She said, my uncle listened and promptly did not follow it.
Well, of course not. That would be ridiculous.
Yeah. Well, I think he's okay because, as Amy told me after the episode, he's so far out from the onset, he's likely not transmitting. So there you go. We love
Yes.
Amy. We love Amy, right, Vincent? Well, no, we don't do right, Vincent, because I'm not right. Amy is right. That's why we go right, Amy, right?
I guess.
Yeah, Daniel did disagree, but we're pretty good about our differences. We are civilized about it. That's absolutely right. Oh, this is just an impossible question. I can't answer this. How many times has Amy been right about something that you were not? I don't know, maybe 1 or 2 times, right?
Who cares?
Oh, listen to that answer. That's good. Who cares? Let's put it this way. Less than 10, less than 50, or less than 100?
Who cares?
Oh, but I'm asking you, Amy, so you should answer me.
What's the question again? How many times has Amy been right about something that you were not? I don't know.
Yeah.
Sure,
I would
less
say
than
1
10.
or 2 times. Yeah, less than 10.
Sure. Who cares? It's like,
But Amy, here's the thing. When you have people answering you questions, it doesn't matter who cares or not. They have a question, you need to answer it. That's why you're here. Okay? I have to say, this image is better than the one on the other computer. Isn't that
well,
funny?
for sure.
I think
No,
the
not
laptop
really.
has a better camera. Yeah.
Potentially.
Do you think the pandemic will be over somewhere in 2024 and that we will get down to 1 in 100,000 cases?
Yes.
Is it over in the U.S.? Many people feel it is.
Now?
Yeah. Right now, today on
I
Wednesday,
don't think it is.
you don't think it's over?
No, I think the emergency phase is over, and that's all we cared about.
Yeah, the emergency phase is over, but I think it's under control because we have vaccines. So in the U.S., but not everywhere else, of course.
Still, a significant percentage of the population is not vaccinated.
What percent is that?
Probably close to 30.
And they never will be vaccinated?
No.
And they have not been infected, do you think? Many of them have been infected.
No,
Right?
I think they have been infected, but, who knows what kind of infection they had.
Flu vaccine will be available soon. Yeah, August, right? Typically. And
Yeah.
Amy, you're not going to be around to make sure I get vaccinated.
Don't worry.
What do you think about
Don't
that?
worry. My reach is far.
I'm not worried. I'm just saying, Amy, for the last 8 years would say, come on, let's go get our flu vaccine. And so I could put her off for a short time, but not indefinitely. Right?
That is true. That is true.
Which countries have had the fewest COVID cases?
I don't know that it matters considering the fact that not all countries report and use the same definition.
Yeah. Well, let's take a look at the Hopkins site and go all the way to the bottom. So cases, okay? Hey. Well, this is only 28 days now. They're not doing the total cases. Yeah, that's not useful. Why are they doing 28-day cases now? Is it the numbers are too big?
I don't know.
Yeah, but I think as Amy said, many are not reporting properly. So let's take a look at world meters. Let's take the column with, here we go. Oh, like Tonga has had 12 cases. Kiribati has had 13. Vanuatu is 14. Bhutan is 21. Greenland 21. Is that possible? Yeah, there are a lot of countries, and I bet they're not reporting. But I'm not sure how interesting that is. Right?
I'm not particularly interested, but okay.
Now, Amy wasn't stuck on the Rockville Pike. What is Rockville
No.
Pike, Amy?
Wisconsin. We drove around.
Oh, it's in Wisconsin Avenue? Okay. No, Amy went down to the garage to get her earbuds and that she has on, those red ones, and probably just took a while. Oh, and then she tried turning on the computer, and it was... Psht. Right? Did you say that?
Yep.
Hello,
Yep.
Rob. Thank you for your support of the Incubator, your unwavering support, I should say. And fungal coverage
There needs to be a fungus metaphor in there somewhere.
could be more than sporadic. Make room for the shroom. Fungify the incubator. Now, Amy, do we want fungus in the incubator? Is that what Rob is saying?
We are not fungiciding the incubator now.
Do you still think COVID waves are driven more by human behavior than by new variants?
Totally.
Yeah. I heard someone say, I don't remember where it was. We have to take into consideration what humans are doing to get infected. Oh, yeah, big time. I work in a mental health facility in England. COVID is rarely mentioned now, neither by staff or public. Mask wearing was dropped May 31st. Yeah. Well, many places, no one's talking about it. No one's masked. They are moving on with their lives, which is what you need to do. Is Amy still wearing cashmere in Maryland?
Yes.
Because your apartment is cold, right? That's what you said?
Yeah. And I even turned the air off.
Yeah, so it's, even though it's very hot out, it's, Amy gets chilly, yeah. Apart from virologists, what specialists should we be going to for reliable and relevant information to develop appropriate policies on SARS-CoV-2? Well, so the virologists need to be consulted so that the others know what to do about the virus. But who should make the decision? Public health officials, not administrators. Many people in positions of power in the public health environment are administrators and have very little public health experience. And this is something that Laurie Garrett discussed quite a bit when she was on TWIV. And also, I think, Amy, she mentioned it at the Incubator opening, didn't she?
Yes.
She said there has been no plan since the start. There's no plan for what to do. So public health individuals, like the ones who used to run CDC and so forth, and, New York City Department of Public Health had wonderful public health officials. There are MDs with public health experience. Now we have MDs with administrative experience. So I don't mean to disparage them. It's just they're not suited for that position because they need to have experience in public health so they know what decisions to make. Would you agree, disagree, or be neutral, Dr. Rosenfeld?
No, I think it's probably correct.
Is SARS-2 really different than the other circulating coronaviruses?
No.
Do they also cause long COVID-like problems and reinfections, sometimes with worse outcomes?
Yes.
You think they cause long COVID?
I think that they cause problems, but we didn't associate those problems with those infections. Yes.
Yeah, I think it's likely, but we just don't know for sure, all right, because nobody's looking. And, you may have someone with some long-time fatigue and they have no idea what it is. So it could be, I think. And this is going to be common cold corona number 5.
Yes.
Is that Mambo number 5? Was that the song?
Mambo number 5.
Oh, you knew it. You got the cultural reference.
Yes. I know Mambo number 5.
How about a polio update? What's happening with polio in the UK? Nothing really, right?
No.
Maybe, did we discuss it here last week?
Yes.
So the polio vaccine-derived polio has been circulating. It's type 2, correct, Amy?
Yes.
Has been in this London sewers, a certain part of London, for a couple of months now. It was probably brought in by someone who, from a country that still uses oral polio vaccine, because UK does not. It seems to have been spreading because there are some genetic changes that are consistent with that. But as long as you keep and I think part of the issue is that the vaccine coverage in that neighborhood was dropped below 90%. So they need to make sure that stays over that so that nobody gets polio. But other than that, I don't think. So the London officials are calling it a likely outbreak. Why is it an outbreak? Is there an outbreak of infection or disease, Amy? Since we've been talking about this for 2 years.
Outbreak of infection. No disease. Not a single person has reported VAP.
So how can you have an outbreak of infection that's probably always there? Just don't detect it. It's just that you don't see it. Is that really an outbreak?
Right. I don't know. What's the definition of an outbreak these people are using?
The commencing of virus reproduction in a population. It's not that.
Well, what's the population? I mean, how much is it? How much of a population? 5 people, 10 people, 200 people, 200,000 people. What's the population? It's big.
Yeah, that's true. You can't test everyone, right?
Mm-hmm.
So the issue is that just because you don't detect it and then you do, that doesn't mean it's an outbreak. It's always been there or could have always been there, right?
Exactly. Most places not necessarily still survey.
Do we survey for polio in the sewage in the U.S., Amy?
No.
After your Would You Like to Buy the Brooklyn Bridge improv last week, I'm now confirmed irreversibly in adoration. What was that about, Amy? Do you remember?
No.
But we said, if you believe this, I'll have a bridge to sell you, right? Something like that. Well, I'm glad you liked it. Glad you liked it. May I ask you a question? You mentioned not eating meat. Is it for your health? Thank you. I hope it's not intruding. No, it's not intruding. Yeah, it's for my health. And also, I don't like how animals are treated. And I can't kill insects anymore. I've gotten to a point in my life where I can't kill insects. Unless one crawled on my mic, then I would probably kill it. But outside, So I don't know. I was thinking about this the other day. I don't know why. But the meat is for my health first, and then the animals after. The way they're slaughtered is really bad. And that's
Jen's here.
I'm not going to make it a crusade. It's just me. Okay, only Doctors Offit and Bernstein voted no to the question. Does the committee recommend inclusion of a SARS-CoV-2 Omicron component for COVID-19? That's correct. The others all voted yes. But if you look at the comments of some of the others, it's quite interesting. So let me bring up this article here from, that's monkeypox. We'll do that later. Coronavirus vaccine should be updated. Okay, this is the Washington Post. 19-2 vote. Despite the overwhelming agreement, many felt they're frustrated and hamstrung by the need to make a decision quickly to prepare for fall with limited data. And I think this is very interesting here. But no one knows what variants will be circulating. It's reasonable to expect that any variant incorporated into the updated vaccine will be in the rearview mirror by the time shots are going into arms, right? Because BA.1, which is what these vaccines are based on, has already been replaced by 4 and 5, right? There's also uncertainty about whether updated vaccines will really protect people better. Companies showed they were able to trigger modestly higher levels of antibodies, but it's unknown whether that will translate into better protection. Arnold Monto, we're being asked to have a crystal ball. Some people, this guy said, we just need to get ahead of this virus. I think we have enough data. Paul Offit said the data are uncomfortably scant. He questioned whether the modest difference in how they trigger an immune response is big enough to translate into a benefit. And I would agree with that as well. So I do like that this article gives you the concerns, right? So let me go. Peter Marks said, despite clear evidence, most Americans have not gotten boosters, right? The better the match to the strain, we believe we may correspond with better vaccine effectiveness. So it's all we think, we believe, and finally, the last part here is very interesting. The process has been compared to picking a flu vaccine, but flu is a different virus. And the director of this division in CBER said, I will remind you that the parallel track of flu strain selection, which works well, is a process that was honed over many, many years. This is a different virus. We have a lot of work to do on the strain selection process. I think that's a really good article that points out no one can tell you whether this variant-based booster will be better or help in any way. They're just saying, yeah, maybe it will, and doing it, and that's okay. I don't do science that way, and neither does Paul Offit. And I think Paul Offit is one of the better vaccinologists in the world. So, and he'll be on TWIV July 8th, so let's see what he has to say. And remember, this is a FDA advisory committee. It's not the FDA, right, Amy?
No,
Hello?
I don't think so. Yeah, I don't think so. It's an advisory committee.
Yeah, it's not the FDA. The FDA in a couple of days now will make their own decision. So it's the advisory committee that they go to for help. And I just think that there's not much evidence. If you want to get a booster, it's fine, but there's no evidence that it's going to be any better. Can I turn on the timestamps? Where? Where are the timestamps and what? I don't know what you mean by the timestamps. Sorry. Did I used to have them and now they're gone? Do you know what they're talking about, Amy?
No. We've never had timestamps, so I don't know.
I don't know what the timestamps are. Sorry. I have building. Here's your neighbor. I have building internet. Heard the solar flares are interfering with electronics. So that's it, Amy. You have solar flares. Okay.
Okay. Sure.
Is chickenpox infection as effective as the vaccine?
Yes.
At what? At doing what? Not effective it's not effective at preventing shingles. Right? You get chickenpox and then you get shingles many years later. So the idea is that if you get the vaccine, you will not get chickenpox and you will not get shingles. So I would say the vaccine is better. Okay?
Sounds good.
And Markle says to you, Amy, I find white duct tape helps me identify the wires to make life easier. Because you said you had too many wires before.
I do have too many wires. I know what each wire is. There's just too many.
Recent TWIV mentioned challenge studies. Way back, did the Common Cold Research Unit ever do viral dose experiments? Yeah, with rhinoviruses. They did. I'm not sure they dosed people. Do you remember, Amy? Those are in the 60s.
Yeah, they dosed people.
So they put known quantities of rhinoviruses, yeah. Mm-hmm. And of course, very mild cold, mostly runny nose. So not a threat to human health. Amy's been brushing up on those lately, right?
Yeah, absolutely.
Wondering how Amy's first week in the office has been. What is she enjoying the most about her new job? I can tell you that she likes her colleagues a lot.
I do.
You have a nice view out of your office, too.
I do.
But they spelled your name wrong, right?
They did that, too.
So Amy doesn't exist.
That is true.
Did I sum it up well?
Uh, for the first 3 days, yes, and day 4 and 5 were even less productive and successful in some respects at Columbia, right?
I can tell you that Amy loves her new job. That's what she tells me. She absolutely
I
loves
do.
it, and she's
I
really
do.
excited about doing experiments. And hopefully
I am.
we can hear about them once they're published, right?
Once they're published, yeah, for sure. But you do have to admit it was quite the experiment getting dry ice on Monday and Tuesday.
Yeah, we had to ship a bunch of stuff to her lab, and it was a little bit of a drama, you would say, right? A drama.
A little bit of a drama? It was a drama-a-rama.
Amy, is everything associated with you dramatic?
Let's hope not.
I'm just kidding.
Because it's
Anything's like,
exhausting. It's exhausting. I'm going to need a vacation from being me.
oh, you said you needed a drink.
I do need a drink that too, but I just got home.
Um,
Haven't even eaten dinner.
do you think we'll be needing to get monkeypox vaccination? It seems the federal
No.
government is gearing up. So you say no, but let me show you the latest numbers on monkeypox. This is the CDC global summary. And
There's 5,000 cases.
in 51 different places. You can see here, Canada has 276. Look at that. France has 440. Germany 874. What does the U.S. have? Let's see. I think the U.K. has the most, right? Let's get down to the U. Spain 800. Yeah, there you go. 1,076 in the UK and 350 in the United States. I mean, this is, Amy, isn't this looking like an outbreak?
It is an outbreak, but it's not a pandemic.
When would it be a pandemic?
When either the numbers are greater or more countries are involved.
So there were 8,000 cases of SARS-1, and that was not considered a pandemic.
Yes.
So here's the U.S. case count. These are all the states that have had a case. We've had here in the Northeast. And, I don't know, 300 and some cases. Who's got the most cases? Looks like Illinois. It's interesting, isn't it?
No, California has the most cases, actually.
Sorry, 80, you're right. That's expected. They have a lot of people. What about Texas? Let's see. Texas has only 8. Wow. That's interesting. So anyway, are we gonna get a vaccine? I think
No.
some people are thinking about it, but if Amy says no, let's write that down and see what happens in a couple of months, okay? Do I think we're going to get vaccinated? No, I don't. I think at some point this is going to fizzle out. Is that the right word?
No. Fizzle.
I know. I did it to, get you to smile. There you go.
No.
Westfield, thank you so much for your support. I don't think a single virologist was in the meeting.
Stanley Perlman is usually at the meetings.
He was there, yeah.
So
he was there.
He's a virologist.
So is Ovita Fuller, a virologist from University of Michigan. She's a herpes virologist. So, yeah, it's an advisory committee of experts, but there were some. So there's some virologists. But the virologists voted to switch, which is interesting. My feeling is they're voting out of caution, right? They don't really know if this is going to be better, but they think, well, it can't be bad, can it? But maybe it could be. I don't know. Maybe we now have a vaccine that's closer to the circulating variants, and maybe now it'll push them even further away. Who knows? On the other hand, I don't think that many people are going to get this updated vaccine. I won't get it unless they make me. And I'm sure Amy won't get it unless they make you, right?
Probably.
The federal government could make you.
No, really? Never would have guessed.
Yeah, and if you need it to work, you're going to do it. And if I need it
I
to,
always need to work. I always need to work. I always have experiments to do.
no, if you need to be vaccinated to work.
Yeah, for sure.
So, what do I think? Pretty much agree with Paul Alford. I don't think there's a lot of data to suggest that we need it. So, obviously, it's going to be done. So we'll see what happens. Which one do you pick? Italian, French, or California? Or it doesn't matter?
French.
Well, where? In what situation? Restaurant or going to a wine store?
Well, I always like a French wine. I like a Burgundy and stuff, but then I like a Barolo too.
I go into this wine store. I go to the California section mostly. Not because I prefer them, but I just go there and I get... I was big into Cabernets for many years, and lately I've liked Pinots. You can tell I'm getting older, I guess. But and now and then I'll get some
You had
Italian
gone
reds.
through a Malbec phase.
I went through a Malbec phase, yeah. And then I like Italians. We've had some Italian reds in the house recently. I love French wines. They're great. But
Yeah.
the Californias can be more affordable, okay, than the French. So not always, but they can be.
Yes.
Hearing mixed things about effectiveness of bivalent vax targeting Omicron. Yes. So if we go back to that article, they actually comment about that. Let's go back to it. That is the Washington Post. So let me just find it. Various companies presented conflicting data. Yeah, here we go. This is quite interesting. Let's turn on the screen share. Various companies presented conflicting data on potential booster strategies, leaving committee members to triangulate between overlapping, sometimes divergent results. And then they go off to
This
pull
doesn't
off.
answer the question about if there's bivalent.
Yeah, well, that's the divergent results, and then one would hope they would follow it, but they don't. They diverge. Here we go. Moderna favors a bivalent vaccine tailored to protect against the original and Omicron. So it's mixed, original and Omicron. Pfizer and found a vaccine with just BA.1 was better than bivalent. They presented, I don't know what this means, was better. Better at what? Inducing neutralizing antibodies? Who cares? I don't care about neutralizing antibodies. They also presented mouse data suggesting that a vaccine tailored to fight Omicron that are protected to soon dominate might provoke stronger and broader immune responses. So look at all the qualifications. Suggesting, okay, and might provoke. Come on. This is not what we want in a decision-making thing. And then Novavax says additional doses could be protective even against Omicron subvariants. Could be. Folks, I don't know about you. Do you want to hear all these qualifiers when it comes to your public health? I don't think so. Do you, Amy?
No.
Amy and I agree. So I understand public health. Sometimes you have to make decisions that you don't have all the data you'd like. But this is not good to say could be or it might, or we think. Okay, so the data are interesting because there were a lot of data actually presented. Let me show you. Can I show some of the data, Amy? Is it okay with you?
Sure.
So this was a presentation. Let me go to the presentation. So you can get all of these online. This is by Ruth Link Gels from CDC, right? U.S. Public Health Service. And so this is their numbers that they go by here. And there are a lot of slides here, but I went to this one. So they look at, infection, all infection, symptomatic infection, different age groups. But what I really want to look at is, let's see, hospitalization. That's the highest they go. They don't go to deaths. You know why? Because there are no deaths in vaccinated people. There are very few. never zero, but there are very few, and they couldn't make any statistics out of it. So let's look at this one. This is relatively straightforward. mRNA vaccine efficacy against hospitalization by time since third dose for immunocompetent adults greater than or equal to 18 years of age. From mid-December to May, that's Omicron predominant, and it's stratified by age. So we have 18 to 49 years, and then we have 3 doses, and these are the number of days after the dose. So you can see with 7 to 59 days, you have a 90% protection. Here's the vaccine efficacy against hospitalization, 90. Then if you go to 60 to 119 days, it drops. And then if you go to over 4 months, 3 months, right, it goes to 54% with huge error bars. And so a lot of waning in that, a lot of variability there. Now, if you go to 50 to 64 years of age, similar data, but the longer one is slightly better. And then over 65, look at the very tight error bars. You got about 80% vaccine effectiveness against hospitalization more than 3 months out. So those are the data the FDA used to make their decision. And I don't think hospitalization on its own is often a good metric. I think there are a lot of variables there that, why were they hospitalized? With COVID or for COVID? And why? And hospitalization in different parts of the country are bound to be different. So I have issues with those data. So that's what I think. Let's see. All right, we're not going to answer that one. Let's see. When virus fuses into the cell, the viral membrane added to the plasma membrane, because spikes present on them will immune cells attack the cell thinking it is a foreign thing? It could. Yeah, it could, because...
It could, but it doesn't.
Why? Eventually it will, because... Go ahead.
Even though it's fused in the cell membrane, it's still internalized.
Right, so the spikes are left behind, though.
I don't think so.
If it fuses at the plasma membrane, yeah, the viral membrane will remain. There'll be spikes. But the point is, later there are some new spikes. Later there are new spikes made that get put to the plasma membrane.
Well, yes.
And those are going to be the targets.
But right, but it's not at fusion. Okay, whatever.
But eventually the cell is going to be attacked by CTLs as the virus produces new spikes. So it's really a moot question.
All
right, Amy, thoughts on Eric Topol's doomsday analysis? It stays in organs, lays dormant, and pops up years later. Is this true?
Well, if he talked to the virus, maybe it told him that.
You think Topol talked to it?
Well, apparently, because it got this answer, right? He got this answer. Because nobody else knows this answer. So he must have called it and talked to it, and this is what I told it.
So, folks, that is Amy at her most cutting. Right? Because she's saying he basically has no evidence for this.
Yeah. Yeah, exactly.
I don't understand why he's doing the doomsday analysis. I just don't understand.
Not clear.
It
gets him still in the news.
That's part of it, but I think he really doesn't understand the data, and he makes these conclusions that are way out there, and I think he likes to get the attention too. Yeah.
Yeah.
Has anyone seen Delta around, or did we just stop sequencing for it?
No, Delta's still circulating.
Very low levels, right?
Yeah.
Yeah, I mean, you can pick it up from time to time. If you go to covariance, let's look at covariance.org, see if we can find Delta. All right, here we go, Delta. It's very low, but it's not zero. It's not in every country. April. Some countries don't pick up any of it, right?
Yeah, I know.
But yeah, it is still a little bit there. Last week, someone asked if it could displace Omicron, but Omicron displaced it, so I don't think that makes sense,
exactly.
right?
Yeah.
Okay, that's that. Way better image of Amy today.
Oh, excellent.
I think her laptop has a better camera than her very old iMac that she was using previously.
Well, I'm not using the iMac camera. I'm using the Logi camera that you purchased. So you're saying that you didn't purchase a good camera.
Oh my gosh, you're right. This is much better. It's doing better than the Logi camera at getting the light right. I mean, do you have the two lights, the two Richard lights on either side? Richard?
Of course. Of
And then
course
you
I
have...
have Richard's lights on.
I think the other issue is that we have a lower angle today, and so we have less of the back wall to fool the camera.
Yeah, probably.
But it does look very good. I agree with you. I agree. A mouse study showed that nirmatrelvir and molnupiravir combined considerably more effective. Not surprising.
No, not at all.
Paxlovid and molnupiravir. Molnupiravir on its own is only about 30% effective at in preventing hospitalization, progression to hospitalization. So, I mean, Paxlovid is about 80%. So, but this is mice. So, they need to do a clinical trial in people.
Mm-hmm.
Hello, Ireland. Alice O'Brien. Love your chats. Excellent. Glad you like it. 2 doses of Pfizer. Should we boost with Pfizer or Moderna?
Doesn't matter.
Doesn't matter. I got 2 Modernas, and then I went for my 3rd shot, and they didn't have any more Moderna, so I got a Pfizer. And what you always have.
And
Pfizer.
did your head pop off?
Well, there's a hole in the back. Do you want to see?
No.
Did you know in mice, if you cut their skin, their hair grows back faster?
Okay.
That's the
That's
paper
cool.
we did on immune yesterday, and I asked because I have a bald spot here, I asked if I cut my head, would my hair grow back? And they said, I don't think you should try that, Vincent.
Yeah, it doesn't sound like a good plan.
All right, so let's point out the problem with this statement. Lots of people have COVID here in upstate New York. Well, they're positive for SARS-CoV-2. How many of them actually have symptoms? Because if you have symptoms, then you have COVID. But remember, if you're just SARS-CoV-2 positive without symptoms, you don't have COVID. Would you agree with that, Amy?
Yes.
Oh my gosh! Tonight I'm batting 1,000.
Excellent.
Is there
There's still an hour to go.
Is there a date yet for the next Incubator open house? It's sometime in the fall,
Between
right?
Thanksgiving and Christmas. Yes. It's
However, folks, I
Thanksgiving
know Elena's in New York, but I am going to do a West Coast trip. We're trying to do it in August. The plan is to go to San Francisco and L.A. And
So you're going to go out twice, or you're going to stay the whole time?
no, it's the same trip. Go to San Francisco the weekend, and then maybe Monday go to L.A. and meet some people in both places. So maybe some of us could get together and chill, right?
You could go with the 2 farms, Kip and Laura, and then go see Richard.
You see Steph as well. She's in San Francisco, right?
Oh,
and
yeah,
and Les
that's cool.
Les is not far. It's outside of the city. Anyway, we'll talk about that when it gets dates get cemented. Richard, yes, the light man. That's right.
Yeah, Richard Lund, yeah.
I mean, I could stay out there for a week, really, seeing everybody. Right?
Apparently.
Can we manufacture vaccines that transfer inherent immunity to the babies?
Well, polio does that.
Okay. here we go. I got this timestamp thingy. Toggle
Oh,
timestamps. I'm very sorry that I didn't do that before. Thank you, Steph, I did it. I put it on. The timestamps are now on. I didn't realize that. I wonder why they turned off. Anyway, can we make vaccines that transfer immunity to the babies? Not memory,
well, we
though,
do.
right? Yeah, the antibodies in
No,
cells,
not memory.
but not memory. So it's
Yeah.
a transient protection, yes. Any immunity can go across by the placenta or the breast milk, right? Can do it both ways. The countries with the lowest cases are the ones that don't report. That's right. So if you see 0 cases, they're just not reporting.
Yes.
I'm not sure I can answer this. Can you explain the degree to which a BA.5, not B5A, escapes vaccination protection? Well, I don't think anyone can tell you that. All they can tell you is neutralization, right?
Yes.
And so Omicron, the original BA.1, escaped antibodies substantially, at least a 10-fold decrease in neutralization. And the 5 is more. But Amy would agree that we don't know what that means. Just what does it mean that the antibodies you make in response to the vaccine have a poor job at neutralizing BA.5? It still protects against death.
It's good enough.
Other things are involved in protecting against death.
Well, we have a whole immune system.
Curious to know what the emergency phase means. Don't know what
When
to
you have
expect.
to put morgue freezers in the middle of your front yard as a hospital.
I think emergency phase is when hospitals are overburdened, right?
Yeah.
And they can't take care of the patients, and we don't want that to happen. So, in a way, these increased hospitalizations are not good. And so one public health measure is to vaccinate people just to keep the burden down, even if it only lasts for 6 months. But that's not a long-term strategy, as Peter Marks said a couple of weeks ago. You can't keep doing that. You have to figure out something else. But nobody knows what to do at this moment. I don't know why the hospitalizations are increasing. The ones we showed in that previous
Well, I don't know
slide.
how they're called. I don't know how they're counted. If
That's
they're
right.
counted
Right.
if you went to the hospital because you had SARS-CoV-2 infection, or if you were at the hospital and tested positive for SARS-CoV-2 infection.
That's
so
right.
I don't know how they're counted.
Exactly right. And I think it's what makes you go to the hospital is different for different people, different states, different health conditions, right? A person that has a lot of health issues will go to the hospital sooner than someone without. So I don't think it's a good metric. What is? Death, but right now there's not much death from unvaccinated people, so it's really hard. How come when you look at the Hopkins death rate for COVID is different than World Meter? Then the BNO news site is different. Why? They're using different numbers, I suppose, because the death rate should be the number of deaths over the number of cases, right?
I would think so.
But that's not even an accurate count because you never know the total number of cases, right? Because you only know the positives. So it's actually much more. So the death rate is lower.
No, you only know the people who come and get tested.
Well, there are a fraction of people who get tests because they need it for work or travel or whatever, and so those
right,
get
but it doesn't matter why you get tested. Because there's a lot of positives out there that don't have any symptoms or have very mild symptoms and don't feel that they need to be tested.
Yeah. Shouldn't fully vaccinated folks, immunized folks, still wear masks for air travel with 30% unvaccinated in the U.S.? Any thoughts? Amy thinks no. I don't. I don't wear masks when I travel in the air because I have decided, looking at the data, that I am protected by my 3 doses of vaccine. But if you feel that it doesn't protect you, you should wear a mask. It's not
Well, I
required,
don't
as
think
you
he's
know.
asking if it's protecting him, if the vaccine is protecting him. He's asking, should we do this because there are many people who refuse to get vaccinated or
Oh,
who
should we
are
do it for
remain
them?
unvaccinated? Yes, so should we do it because we're protecting those who either refuse or cannot get vaccinated for various other reasons?
I don't think it's, if you want to, that's fine. I mean, that's altruistic. I think they should get vaccinated. There's no reason not to. I mean, 1% of the population has a bona fide medical exemption, but 30% does not. And they've made their choice. Why should we wear a mask for that? I mean, that may seem insensitive, but that's how I view it. I understand that not everyone will view it the
Well,
same way. Yes, go ahead.
I mean, one could view the people who could get vaccinated who refuse as very selfish, right?
Yeah, it's both me and them is
So,
a problem, right?
yeah, exactly. So,
I have to say, I'm not the target audience. Construction landscape worker from Minnesota. I got hooked on the podcast a year ago, searching for good information. I appreciate the real facts data. You are the target audience. Of course you are.
for sure.
We want to educate people about science. Doesn't matter what your job is. Now, so I wonder why you say you're not our target. Maybe, no, I don't. It doesn't matter. You're our target. Believe me, we love it when we have people from all professions listening, because viruses impact everyone. Amy, did you know that some viruses only affect people with MDs and not with bachelor's degrees? Did you know? Oh, that's a joke.
I must
That's a
have
joke.
missed that. I know.
Which,
I must have missed that.
because your internet was broken?
Exactly.
Is there a downside from an immune point of view for taking the second booster?
There's always the potential of autoimmunity.
Yeah, but I think it's very low, Amy. What's
Yeah,
happening
for
outside
sure.
your
But
window?
I'm just looking. I believe that that's part of Paul Offit's logic,
Yeah, I,
is that
I
there's
think
always
I
a
think with
potential.
4 boosters, 5 boosters, that's fine. 60 boosters now, that could be a problem.
Maybe.
Or maybe
I
not,
don't know.
depending on who you are. So if you
Apparently
feel
not.
that, listen, I tell you what we think based on the data, but if you want to get your booster, it's fine. And I don't think there's a substantial downside to it. There's a theoretical downside. I don't think it's an issue.
No.
My 4-year-old got COVID for the first time from preschool, Memorial Day weekend. What was going to wait until he starts school to start the Pfizer vaccine for him. Do you agree? So Memorial Day was
Oh,
like the beginning of June, or end of May, right?
yep. Get
I would
vaccinated.
no, I would start it now, because you
Yeah,
need
that's
to.
what I just said. Get vaccinated.
Yeah, we agree. Once again, Amy, you and I agree,
This is not good.
but it is still an hour left, so it's not an issue.
I did point that out earlier, yes.
You're a smart whippersnapper, I tell you. Where did
I
you get
am a
trained?
smart whippersnapper.
Who trained you, Amy?
The older whippersnapper.
I don't take credit for all your training, but some of it, because obviously you
It did
arrived.
a majority portion of it, and then we'll give Wetmer a few. We'll give
Yeah, yeah.
Wetmer a few shakes.
Well, you also went to college. You had a good education in college. You had a good brain to begin with, right?
Yes.
So I have to tell everyone I got a letter to Twiv, which I forgot what the main question was, but he said, Amy, including Amy, my hero, who doesn't take anything at face value. And that's what Amy does. She doesn't take anything at face value. Always be critical.
Nothing. That is true.
And, in some cases, she looks at it and goes, okay, I buy this, but be critical. Especially at
Oh,
information
would that be like the shape changing viruses where it was like, oh, this is a lab artifact?
yeah, that's right. she never lets me forget it. When I do a paper she doesn't like, she never lets me forget it. But that's fine. I'm really happy you have a good job. All right, gnome gardeners. I like this one, gnome gardeners. Why is COVID so contagious? Well, COVID is not. The virus is contagious. I've had many vaccinated healthcare employees with COVID 4 and 5 times. Masking is required. They're getting exposed outside of work. Well, the vaccines don't prevent infection. They modify disease. They make it more mild. They prevent death. So, but your question is, why is it so contagious? Well, the latest, Omicron variants are really good at evading antibodies. And so that probably allows them to take better hold in a person than the previous Delta, which wasn't as good at evading antibodies. And there may be more than that, but that's one of the things we know. What do you think, Amy?
Okay.
I don't think it's I don't think it's physically any more stable. I don't think it reproduces to a higher level. I think it's immune evasion that makes it more infectious.
I don't really like the term infectious. It makes it more fit.
More fit?
Because you put the same PFU on a cell line, and you get the same number of cells infected. And infectiousness would suggest that you get more cells infected.
Yeah, I agree. Here's a good way to look at it. Let's say you have 10 people in a room, and they're from all different families, and they're genetically diverse. And someone walks in who's infectious and shedding. And with Omicron, maybe 5 people will get exposed, and infection will start, but maybe with Delta, 2. And the difference is evading immunity, because Omicron comes in the nose and then the antibodies don't stop it. So what would you call that, Amy, if not infectious?
It's just immune evasion.
The infectious in cell culture and infectious in people that kind of have 2 different meanings, really, right? Because we don't do plaque assays in people. That's the way I look at it.
I don't think that they really have 2 different meanings, but sure, you can go with that.
Okay, there's our first disagreement. Okay. Is it true that Pfizer wears off after 2.5 months in terms of severe illness? No. Is it safe or necessary for under 50 to get another? So, at Pfizer, how many doses? 3 doses. I showed you the data for both mRNA vaccines. They maintain effectiveness against severe. And so it depends on how you define severe illness, right? Is it an emergency room visit?
For sure.
Is it hospitalization? And what I didn't see in that.
Why focus on that detail?
In my view, they should use ICU admissions, and that wasn't present in those data, because that's really the metric. And I think they don't use it because there aren't enough ICU admissions in the population that they did, because you'd find that it doesn't go down after many months. So is it necessary for under 50 to get another? I mean, I don't think so, if you're healthy. 3 is what we have. Is that a fair representation of our statement, Amy, or our stance?
Yeah. It's fine.
All right. So Alfred wants to know about Sweden's approach, and I have no comments on Sweden's approach. Do you, Amy?
No, I don't know enough about it.
So the prevailing idea is that they more or less let the virus spread, and it took out older people, of course, because they're the most vulnerable to severe disease, and they were not interested in stopping that, right? I find that hard to believe, so I'd like to really see a description of exactly what it is that they did, because months ago when we talked about this, people from Sweden said, no, you're wrong, we didn't do that, so I don't want to comment on it. What are some of your all-time favorite TWIV epitope titles? Do you have a favorite, Amy?
No.
Let's see. I have some favorites. At the beginning of this year, I asked people for their favorite epitope titles. So let's see what mine was. I can tell you what mine was. This week in what? Virology? This week in virology, yeah. Let's go archive. It can go, I'll do this very quickly, folks. Be patient. We're talking about January. What was the episode number roughly in January, Amy? Do you remember? September 2021. That's 808. So I know we're getting close to 820. October. What do you think the title?
880.
880 was the
I have
January
no
thing?
idea. I bet you it's somewhere around there.
Oh, so January is 853. There you go. And January 7th, first episode of the year, Arc of the Epitope, or on Dasher, on Dancer, on Corona, and on Lassa. That was January 2nd, final episode of 2021. So that's, and the reason I need to know is 847. So now I'm going to go look at the Google Doc for 847. Because these didn't make it into the show notes. Okay, your favorite last episode for 2021, but that's actually not a review of 2021. So 847, it should be 848. Of course, that could be Daniel's. That's Daniel, so it's 849. Yeah, this is it. Your favorite titles. Vincent, Grand Theft Kinesin was my favorite title for 2021. And The Clot Thickens was Rich Condit's. Another epitope with Shane Crotty was Kathy's. 2 Errors Viral. A Mad Virologist Tea Party. And that's just for 2021. I don't know about all time. Does anything stick out in your mind, Amy?
No. No.
I know which one you liked. Zika with a Slice.
Zika by the slice. That's okay. It was fine.
Because Amy
It's not
was
the
studying
greatest, but it's
Zika in
fine.
brain slice cultures. That was a good title.
It was. It was.
Reading these, the faster multiple effects are dangerous. I don't know what you're talking about, Rabbit. I'm sorry. Do you know what he's talking about, or she?
No.
Yeah, I need a little more details there. I'm sorry. Thank you, Hoder, for your contribution. Your voice of reason kept me sane. Thank you. I'm glad you think we have a voice of reason. West Coast, wanted to give you a like, but I have to put the kids to bed. Thank you so much. We have almost 500 people again. I'm so impressed. 482. Why don't you give us a like? We have only 200 likes. Hit the like button at the bottom of the screen. That would be great. I may be wrong, but I thought part of the reason for severe and long COVID was due to the virus being novel. No, it's not correct. Other viruses can cause long whatever. I mean, ME/CFS is likely a long consequence of some virus infection. Do you believe Omicron BA.5 is less pathogenic, more contagious?
No.
It's not less pathogenic, no. The Omicrons can still kill unvaccinated people. More contagious, if it's more immune evasive, it's going to be slightly more contagious, yes.
Mm-hmm.
Okay? So, yes, I would buy you on that part. If one is up to date on vaccination, is there any place in particular that you believe we should still be wearing respirators regularly? I think if you're a healthcare worker and you are exposed to many people on a daily basis, you should wear masks because you're going to get infected over and over again, and that's an unusual situation. Thoughts, Amy?
I'm not sure I agree with that, but okay.
You can disagree. It's fine. You don't think healthcare workers should wear masks?
No, if they don't want to.
No, I think they should. When I go to the doctor's office, I have to wear a mask. I'm fine with it. Do you think asymptomatic transmission is what happens in common flu in the summer? I think there is some, yes. I think there's low-level circulation. Some people have some symptoms, right? People do get respiratory disease in the summer, and then there's asymptomatic.
Sure.
But I don't think the asymptomatic accounts for maintenance of the virus in the population. I think it's a mix of symptomatic and asymptomatic. I'm seeing info that repeated infections with SARS-CoV-2 leads to worse outcomes. So that was something Daniel reported, I think, last week or the week before. There was a study that looked at that, yes. And so I asked him, what's going on? What are your thoughts on the mechanism? And he didn't actually answer it, Amy. He didn't
Shocking.
answer it. I knew you were going to, I wanted you to say shocking, so I said that. So I don't know what the mechanism is. I think my opinion is that people who get repeated infections have some other health issues, and maybe they have an immune issue, and it's not clear if they are all severe infections, symptomatic or not. I think that we have to do more work on that to figure out what's going on there. But the data, he showed those data, the charts implied that if you have more infections, you have other issues. But I think that's because people who get more infections are sicker, and they have more issues as a consequence. Have you seen the data from Canada where dozens of folks with long COVID were imaged with more detailed MRI? It showed issues with lung function that weren't seen with normal MRI or CAT scans. Did you see this paper, Amy? I didn't see it.
No, I did not see it.
So what's the implication that these altered... So the thing is, you have to do the same MRIs on people who don't have long COVID and see if there's no... So people who had COVID and didn't develop long COVID and see what their lungs look like. Hopefully they did that in that study. Let's take a look. Long COVID, Canada, MRI, lung. Maybe those code words. Oh, I see. Cause of long COVID revealed by lung imaging research, Amy. The cause of long COVID. Thanks to research at Western University, where we were for a meeting once, remember?
That's where you were president.
I was president of ASV. You know, folks, I was president of something at one point. I got elected, actually. Can you imagine? I got elected president. So 500, the air sacs, blah, 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 9 months post-infection. Yeah, they see these alterations in these people. I don't see that they did a control. Yeah, it's covered all over, but I think it's a preprint. A lot of these people, remember, had oxygen for a long time, which can also damage the lung. Right, Amy?
Yes.
So I think that's part of the issue there. Ed Yong wrote Monday in The Atlantic, America is sliding into the long pandemic defeat. Almost all government efforts to curtail the coronavirus have evaporated.
Why are we sliding into long pandemic defeat?
Well, Ed Yong
with vaccinations and antivirals.
I don't get it. Yeah, I mean, we have vaccines that work. We have antivirals that work. We save a lot of lives. When you are vaccinated, you don't die for the most part. How is that sliding into pandemic defeat? I simply don't agree, and neither does Amy. So
I don't even understand what pandemic defeat means, but
we'll probably have to read the article to get the gist, right, of it.
Okay. You read, report back.
You want me to do that?
Yeah.
Do you subscribe to the Atlantic, Amy?
No, but I generally do read it. No, I don't subscribe, but I generally do read it. And no, I don't really want you to read it and report back.
I was actually thinking of subscribing to the Atlantic.
Many of the articles are free online.
You can read like 10 and then they start bothering you. But, you know, I'm at the front page. I don't really want to see politics, okay? I don't want to see politics. And that's all it's on the front page. I just want to see the science. Catherine Wu, this will be a revaccination reboot. Right. Maybe I won't subscribe. Anyway, we disagree, Jack. Since antibodies are less effective with the new variants, is it just the T cells and B cells from the vaccines keeping many out of the hospitals?
Who knows? Could be NK cells.
Memory. Well,
Be complement. Could be lots of things.
I think.
Could be non-neutralizing binding
Well, first of all,
antibodies.
it's the memory cells that are keeping you out of the hospital, right? Because antibody levels contract after so many months, and so do functional T cells. So it's the memory cells that respond. There's always a delay, and the T cells are a good candidate. Probably the B cells make a difference, but as Amy said, there are other immune cells, NK cells, etc., that could also be playing a role. We just don't know, and very difficult to know which cell types are doing it. So the thing is, Markle, that the antibodies are less effective, but people still are protected against dying, right? And going in the ICU.
Yes.
So something other than antibodies is involved. How long does the flu vaccine last? Well, you get a new one. What's that? Go ahead.
It depends. Sometimes they tell you in the middle of the season to get a booster.
Yeah, it depends. So the virus can change from year to year, and they need to accommodate that. And also, the memory resulting from flu vaccination doesn't last very long. So we need to get a better flu vaccine.
I'll work on it on my spare time.
I don't think you have time to do that. You're working on enteroviruses.
That is true.
But I think
there's 200 of them at minimum. I'm going to be very busy.
Yeah, Amy's going to take care of that. But
so I guess between 3 and 3:15 will be my flu time.
Not going to work on flu. Please don't dilute yourself, okay?
No, I'm not working on flu.
Okay, Pete says, Beckton Sewage Works collects from a huge area of North and East London. Yeah, apparently in some neighborhoods up there, the vaccination coverage went below 90%. Oh, here's your friend, our friend. Hello, Animal Planet.
It's Jen.
So you should show Jen the picture of her painting on your desk.
I'm going to send her the picture of the painting in my new office. It arrived on Sunday, yeah. I just haven't gotten to it yet. But I've been meaning to.
Could genetic variation in the receptor gene be one of the reasons for the wide variation of outcomes? There's no evidence that that's the case. Nope. I think early good interferon response, not having autoantibodies against interferon, are some of the prime reasons for different outcomes. And also, so that includes polymorphisms in sensing genes, right, Amy?
Yeah, for sure.
Does RegenCov still have a role in treatment? Nope.
I don't think so.
It doesn't do well with Omicron, no. The only thing that we use is Evusheld for prophylaxis, and what's the other one? I've forgotten the damn name.
Bam Bam?
Not Bam Bam. No, Bam Bam is out. I know everyone's going to know this, whereas I've forgotten. I just Bebtelovimab. Damned names. Damned names. I have to tell you that I have stink bugs here throughout the house. I don't know why. Oh. And one night I came down to do this live stream, and one was on my mic. It was already dead. They often just, I see them and they're dead. I don't know why. Maybe they dehydrate, but one was sitting on here. Even if a spider were on my mic, I'd probably just flick it off and say, go live somewhere else. Please detail needing a booster. I think we've talked a lot about boosters tonight. Amy and I don't think you need a booster, a fourth dose. We don't think you're going to need one of a different variant. And Paul Offit, who's a vaccine expert, agrees. And there's a lot of reasons to know that. But the current vaccines will protect you very well against death. It may not protect you very well against getting in the hospital, but it's not clear. If you want to be safe, get the booster. Just spotted another moth on the wall, a carpet moth. Well, that's not, you don't want moths to eat your carpet, right?
Right.
If B5 makes the vaccine more than 50% less effective, aren't they basically getting around the vaccine? Sam, the vaccine protects you against death. That's not getting around the vaccine. No vaccine protects against infection. This vaccine protects against severe disease. It doesn't prevent you from getting infected or getting the sniffles. So no, it's not basically getting around the vaccine. Who is it that said eat intelligently, mostly plants and not a lot? I forgot who said that. Let's find out. Eat plants, not too much. There's a guy who said eat food, not too much, mostly plants. Right?
Sounds about right.
Michael Pollan, in defense of food. Eat food, not too much, mostly plants. I mean, what does it mean, eat food? Of course you have to eat food. What else would you eat? That's the definition of what you take in for nutrition. I'm suspicious that monkeypox has been around the U.S., Europe for a long time and mistaken for other vesicular sexually transmitted diseases, but nobody was doing PCR. Any way to detect in old samples? You could. It would be possible if you had such samples. I'm not sure that you do. However, the vesicular rash is quite distinct, so I don't think it would be undetected. You know, there were a few hundred cases. Well, you're saying U.S., Europe, but it was certainly present at hundreds of cases a year in parts of Africa. But I think it's worth testing some archival samples. You could do that, yeah, and I wouldn't be surprised if someone was gearing up to do that. Susan Weiss might disagree about Amy's take about 2,2-E and LC being in any way comparable to SARS-CoV-2. She's not on social media, though. Well, I don't know what the last part has to do with anything. We know how to reach. Do you want to disagree with Susan?
I never disagree with Susan.
It's a coronavirus that is causing a respiratory disease. Now, right now, it's causing more severe disease than the common cold coronas. But in many aspects, it's...
Well, because we're immune naive. But what do you know what happened when those spilled over into an immune naive population?
No, I don't. And the point being that,
okay,
as Amy said, eventually the enough of the world will be immune to SARS-CoV-2 that there will be very, very little disease, as we see with the common cold coronas. But I don't know how long that's going to take.
Years.
Margot wants to know if you're okay. She's never seen you so quiet. You're tired, right?
Yeah, I'm fine. I'm tired. I packed, I drove, I went to work, I unpacked, I did some stuff. Yeah, it was a long day.
Sadly, you have to drive
Was it not?
New Jersey this weekend again for like 24 hours, right?
Yeah, basically. And there was a lot of traffic. It's always tiring to sit in traffic. There was traffic like exit 80 and exit 77 and exit 74 when I came back. And then there was a lot of traffic on the way home for some reason. Maybe because I left. This is the latest I've left the FDA in ever since I've been there, which has been, 3 days? So what do I know?
People are confused about whether they're contagious or not when they test positive.
That's because the experts are confused.
Yeah, so the point is that the vaccine definitely depresses the amount of virus that you're shedding, and it compresses the time of shedding as well. So you are contagious for a shorter period of time. And so if you're 6, 7, 8 days out of your initial symptoms and you've been triply vaccinated, you're most likely not contagious to others. But these troops are being cautious, right? They don't want to get sued for having people say, oh, you let an infected person come into our troop and we got sick and now I have long COVID. They don't want to deal with that. So they're erring, and I don't blame them, because when you put a lot of people together, there's litigation involved, right? Always.
Yes.
Will you guys ever have John Udell back on? Probably at some point. Yeah. Is Moderna better at the T and B cell production? Just wondering. They say it takes another booster after 3 Pfizer to prevent severe symptoms. I don't think one is better than the other.
I don't think so.
I think 3 of both will prevent death and a good amount of severe symptoms. And the thing is, the people, by the way, the people in those studies who developed the more severe symptoms, I think they have other health issues that maybe they don't know about. And I know they try and randomize the populations to account for that, but they may not be. Is there any evidence with the mRNA vaccine to sustain original antigenic sin?
No.
I don't see any evidence for that. It was a theory that it could happen, but I see no evidence that original antigenic sin is, because they protect very well against Omicron, which is very diverged from the original virus from which the vaccine is.
That's not what antigenic sin didn't mean that.
I know what antigenic sin is. Yes. Antigenic sin was originally coined for flu, where you make a memory response to the original influenza virus that you were infected with. So if you were infected with H1N1 in 1957, then in 2003, if you get infected with H3N2, you mainly make an H1N1 response. That's original antigenic sin. But
maybe this man naked HDZYX has antigenic sin with his oh my god sex Tinder and cheap Tinder ads. Wow.
Amy, these things are taken out. Don't say that, please. I avoided learning details for a long time because, she's talking to Patricia, sorry. I would really love a breakdown of the cameras and microphones plus the software you use. Your teams always sound and look great. I don't think most people are interested in that.
Go for it.
No, I don't want to do it now because
you just finished telling me you had to answer the questions then. So I'm sure you can give a brief summary.
All right. So what I use and what my hosts use are totally different. So I use Blackmagic cinema cameras, 4K. I have one here and I have 3 at the Incubator. I record mostly with Zencastr, which records everybody locally. I use good microphones. This is a Rode microphone. I use Heil PR40s in the Incubator. They're recorded locally as backup, but the Zencastr records to the cloud. And then I edit the sound with Logic Pro from Apple, and I edit the video with Final Cut Pro from Apple. And I have a workflow that I've honed over 10 years, so I can do it relatively quickly, and it sounds good. Now, my hosts all use different cameras. Many of them are on Logis, which we learned tonight are not so great. I could get you a really nice camera, Amy. Okay? Would you like me to do that?
Okay, fine. Okay.
Or you're going to get a laptop.
Really nice camera.
Wait.
Then when the camera shows up, you're going to have to spend 3 days installing the camera. So that's the plan. So Amy, that works out well for me.
Amy, listen. You're going to get a new laptop, right?
Yeah, I need a new laptop, but I need a monitor. I need a big monitor.
You're going to get this MacBook
Pro.
Pro.
But I need a big monitor.
Well, that we can handle, but this laptop has a very good camera. I did a pod last week on it, and it's very good. So we'll see how that looks. If it's no good, we'll get you a really good camera. Okay. Anyway, Rob, that's what I do.
Said, you figure it out, and you get back to me.
Hello, Doreen. My daughter joined. Thank you for your contribution. You're very generous. My daughter joined with us for her first TWIV Q&A. Her question, RE monkeypox, was already answered. Thank you. Cool.
That's
You got
great.
spread it in the
Very
family,
cool.
right?
She's a TWIV family.
Impossible burgers are about $4 a pound. I like Impossible burgers. Some people don't like them, and
Is that expensive?
I don't think so. I think meat is more expensive than that. Even
I have no idea.
ground meat. You don't buy meat, right?
Very rarely do I buy red meat. I eat a lot of fish.
Now, someone said, "Oh, that's not meat, but there's other garbage in it that's not good for you." You can't win. Does anybody know? Are these Impossible burgers a problem? Is there something in it that's bad? I like them. I don't eat them that often.
You know what? If you ate a French fry, somebody would come and tell you you were eating acrylamide and you were going to get neurotoxin. So, got to go with the flow.
But those Impossibles taste good.
I've never had one, so I don't know.
Would you like to try one?
Yeah, eventually I'll get to it.
Was the SARS-CoV-2 first established in the nasopharyngeal cavity, the bronchi, or the lungs? No, in the nasopharyngeal cavity first. Comes in your nose, nasopharynx, and then that's where most of the virus is made that you transmit to others, right? Makes sense. And then it goes down into your trachea and bronchi and possibly into your lungs. There is a sequence, for sure. Is you good with that, Amy?
Yeah.
Do you feel the ancestral vaccine is good enough? Yes. I think we've said that ad nauseum tonight. And if so, is there any worry of original antigenic sin? No, as we just explained.
Just answered that.
Yeah. I know these comments often come very close to each other, so, I understand that they're asking the same thing. Let's see. Okay, this is a continuation of the earlier comment about the 50-member troop. The infected person was given Paxlovid, removed from the group, all are vaxxed. After 5 days, they brought him back.
Sounds fine.
Yeah, that's fine. CDC requires, but it says if you still feel crappy after 5 days, you shouldn't come back. That's the caveat there. I saw the German health minister and a couple of other countries are recommending another one, regardless of age. Just want to be protected against severe disease. Brittany, if you're worried against severe disease, get another boost. There's no downside, in my opinion. Not a COVID question. No problem. My doctor recommended hepatitis B vaccine. Is there any difference between the vaccines available? I'm not aware of any differences.
Nope.
I think you should get whatever one you can.
Yeah, sounds good.
What you doing, Amy?
Oh, I went and tried to move this bug off the computer, but it didn't really work. So
is it a stink bug?
Whatever. No, I don't have stink bugs in my house.
What kind of a bug is it?
Just some six-legged bug.
Like these 6 legs? Oh, this is 8 legs.
That's centipede. There are 8 legs. No, 6 legs. Hey.
If I catch it again, should I get Paxlovid? Well, Paxlovid is for people. The EUA for Paxlovid is you have to be.
People give it off EUA all the time. Let's get to it. Let's not quote something that's not realistic.
Excuse me. I want to quote what the EUA is saying, and that's what Daniel does. I think that's fine. The EUA is for people over 50 with other health issues.
And he gives it to people who don't have health issues.
Well, I don't care about that. That's fine. I asked him if I could take it prophylactically before going to Europe. He said, no, the EUA doesn't cover that. It's fine.
Well, yes, but prophylactically is different than giving it to a 12-year-old who has symptoms. The
12-year-old is not covered. The 12-year-old is not covered under the EUA. The
12-year-old is still getting if he has symptoms,
I understand.
He's still getting Paxlovid.
I know many 20-somethings.
So consequently, right. So consequently, your question is not even in the same realm.
No, it is. I am completely
Prophylactically is
in
totally
line.
different than
Oh, okay, that's fine. But I am in line to quote the EUA because I don't want
sure,
to give
fine, whatever.
incorrect advice. So it depends, Jeff, what if you're in the EUA
Go
category.
talk to your physician.
I don't know why you're getting annoyed with me. It's the EUA. That's the definition.
Because I think it's totally unrealistic to quote something that nobody is following.
I, I don't care if they're following it or not. That's what the EUA says.
Therefore, yeah, well, there's lots of rules. If I told you what the rule actually was, you know, you wouldn't. It's like it's not even it's not realistic to say that
Okay,
this is
got
what the
it.
rule is because
All right.
nobody does it.
All right, I got your point. All right, there's no need to belabor it. I made sauce with Impossible Burger. Yeah, that's good. I've made sauce also, like spaghetti sauce, right? Yeah, it's good. I've made meatballs also with Impossible Burgers. It's good.
Interesting.
So, and then finally, part 3, someone told them that he was probably still contagious, but they say, no, the CDC says it's okay now. How does this someone know that
Yeah,
they're
they're
probably
not
still
contagious.
contagious? No, they're not. I mean, look, it's never 100%.
Probably.
It could be, but it's unlikely. Not long after that, and we're continuing. The whole troop came down positive. They decided to keep quiet about it. Less than a week later, my friend saw on social media that they were all out and about. It's really unlikely that they would all come down positive, I think. But, you know, there's never that kind of an attack rate. Daughter 15 COVID positive, took Paxlovid. Now horrible migraines, chest pressure seem related.
Okay.
What?
15. Totally not covered by the EUA.
I understand that. I wouldn't, if I were a doc, I wouldn't have given this child Paxlovid, but their doc did. It's fine. Now, checked out, okay with doctor. Don't take steroids, no. I mean, if your doctor says it's okay, what else? You see another doctor if you're not happy with it, but don't take steroids, no. It's not likely that it is an ongoing SARS-CoV-2 infection. Many initially not keen on boosters. But with each booster, there fewer and fewer people are getting it. So yes, people are not happy about boosters. And I think fewer will get it in the fall as well. And finally, so I think they're spreading. I think there are many people like this. I think they will get on planes and think nothing of it. They think it's fine. What's the correct messaging? The correct messaging is most people will be fine if they're infected. They may get a mild disease. Some of them may end up in the hospital, but most will be okay. And the question is, do you want to keep disrupting your life for a common cold, pretty much? And the answer is no. So the messaging is, like the CDC says, if you test positive, you should, stay home for 5 days. And if you feel better and you're negative, that's it. Go out. Frankly, I think that for a vaccinated person, that's the limit of what you should stay home. But again, on the other hand, what does it matter if you infect someone else as long as they're vaccinated, right? Thoughts, Amy?
Yeah, that's fine.
So Angela has COVID and she can't sleep, so she's watching us live in Ireland. I'm sorry. I hope you are learning something.
Sorry that you cannot sleep. I know that feeling.
I had COVID last week, was only sick for 5 days. Not sure if it was the vaccine or the Paxlovid, but glad it wasn't a breakthrough. It was just a sore throat. Vaccines and drugs can work. My client tested positive today, tested negative both antigen and PCR yesterday. I trained her on Tuesday. I was double masked. She was not showing symptoms. And then the rest is cut off. You're masked, you're fine. And you're vaccinated, right? Mm-hmm. Should be okay. A lot of people talking about food. After chickenpox vaccine, some children get shingles. Yes, some, but nothing is ever 100%, Ian, as you know. I was watching Q&A November 2021. The question was asked, how long the primary 2-dose COVID will be effective? You answered, probably 10 years. Do you still think this? I do. I mean, the 2-dose, its effectiveness against more severe disease went down, but it was restored by the booster. That 3rd dose, I think, was the key. And so maybe the first 2 wouldn't last 10 years, but three I think will. Thoughts, Amy?
Sure. Sounds good.
Has anyone mentioned how bad modern animal farming is for the environment? I love the story about the piggeries and the date palms that the professor tells us in his lecture. That would be me.
I see.
Pig farming is terrible, yeah. I guess other forms are
Chicken
as well.
farms are just as worse. Are just as bad.
Yes. Please discuss recent uptick in SADS. You mean the sudden death? I don't know anything about it. Do you, Amy?
No.
Don't know anything about. I know about sudden severe acute diarrhea syndrome coronavirus. I don't think that's what you mean, right?
I don't know what she means.
Let's look. SADS. Oh, come on. Can I not type? Cove. I don't think there's an uptick in that, so must be talking about sudden death, and I don't know anything about it. I'm sorry. All right, 3 out of 4 of us positive and symptomatic. Son still negative, but was exposed. Will he have antibodies, T cells, protection, even though PCR negative? Not likely, I think. Right, Amy?
I disagree with that.
You think he will have protection even if he had...
He just could have been, it could have been underneath the level of detection, sure.
But how do you know you would get a good immune response to that?
Do it tighter. Or actually, you don't know what a good immune response means. He's protected against severe disease. He didn't develop disease, right? So it's sufficient to protect him.
Okay, well...
If you want to know if he mounted an immune response, do a test. I don't think you can say anything, actually.
I would like to. I would like to
Go
say
ahead.
if you're PCR negative, I don't think you have enough antigen to induce an immune response.
I disagree with that.
Okay, that's fine. Timestamps are like bookmarks. Yeah, I know what a timestamp is. We do them on our pods, but I didn't know what they meant with respect to the chat. And now I see that each chat comment has a timestamp next to it. And apparently you can turn those on and off. Okay, so I didn't know that it was off for some reason. I mean, I didn't touch anything that would turn it off. How about a T-shirt that says, Right, Amy?
I have one. I have 2. Dania made them years ago.
Yeah, Dania, our moderator tonight, who is also known as Vanity Nutrition, made them. I'm going to show them to you because they're right here at cafepress.com/twiv. Here you go. You're going to like this. See, there it is. Right, Amy, T-shirt, dark.
Yes.
Is there another one too, or is it just right, Amy?
There's long sleeve.
Yeah, there's the men's. Life is an asymptote. That's a cool one. And she made some recent ones. I don't know where they are. Maybe they're all the way at the bottom. I don't know where they are. Anyway, yes, cafepress.com/twiv. $1 of every sale goes to the support of Microbe TV. Is there any data on the effects of repeated infections of COVID with each new variant? Yes, there are some. There's some data on, as we mentioned earlier, in some populations, more infections give you other issues with different organ systems and so forth. There have been studies of the immune responses to repeated infections. Is there anything in particular you wanted to know? Is it safe or necessary? Oh, this is Brittany. I think we've answered you already, yeah. I watched the FDA meeting today, and I believe they said Novavax with Omicron will be available in July. I haven't been boosted yet. I would like to wait to get the Novavax. It's fine. I don't think it's a problem. I mean, if you haven't been boosted, why not boost with that? I have no problem with that. And Novavax is a different vaccine. It might be a useful mix. I found a case of monkeypox in New Jersey. Yes, I heard that. Yep. Yep. Okay, so I got your big long chats, GRR. We already talked about that. We talked about vaccine. Will smallpox vaccine work against monkeypox? Yes, it will. In the U.S., we have a smallpox vaccine stockpile, and so we could use that if we wanted to. So if there were an extensive local outbreak, you could
sop it up.
Yeah, do vaccination to prevent that. UK modelers this week predicted thousands of new monkeypox cases per week in the coming months. Doesn't seem likely, though. I agree, it doesn't seem likely. I don't know what they put into their model, but it seems unlikely to me. But we'll see, right?
Yes, we shall see.
I heard hospitals will only test men who have sex with men for monkeypox. I find that odd as well. That doesn't make any sense to me. How do I donate? Microbe.tv/contribute. Morris, thank you for your contribution. I appreciate it. We appreciate it. It goes to support the Incubator, our studio in New York City. The New York Times says the Health and Human Services Department will immediately make available 56,000 doses of the Jynneos vaccine. Do you know what that is, Amy?
No.
Monkeypox vaccine. U.S. rolls out monkeypox vaccine plan. Tens of thousands of doses. I didn't know they had here in the U.S. It's a replication. In 2019, FDA licensed Jynneos, a replication-deficient modified Vaccinia Ankara vaccine. I didn't know that. There you go. I thought we were going to use smallpox. So I check my original comment. So Amy, apparently...
We don't even use smallpox for the smallpox vaccine.
Vaccinia virus. But this is monkeypox virus. So curious. Very good. Thank you. Thank you for pointing that out. Pinots are from us olders? For us? No, not necessarily. I just found that I started to like them more as I aged. It's probably just an association and not causation, you know. Pinot has the most resveratrol of all wines. Good. And California is too high in alcohol percent and fruit bombs. Well, I wouldn't drink one that's too fruity. But one of my favorite California wines is, well, I love most of the wines made by Paso Robles. I really like Daou, D-A-O-U, right? That's really cool. But all of their reds are very good. That's a cab, I think. Yeah.
Yeah.
Wine. European wines are lower in alcohol percent. Well, I don't know why you'd want that, right, Amy?
I don't know. Everybody wants something different.
Is there any evidence of negative outcomes when vaccinations are repeated multiple times over short periods in terms of impeding the body's innate immune system? No. It's not at all, right? Because that's the idea behind giving OPV to prevent other infections. You boost innate immunity. Correct, Amy?
Right.
Are they any closer to understanding how COVID impacts so many systems in the body? Have seen paper on the ability to target T cells similar in part. No, that's not. That's a pretty rare outcome, targeting the T cells in SARS-CoV-2. I don't think you should say that the virus impacts these systems. I think a lot of the system effects are due to inflammation induced by virus infection, not a direct consequence of virus reproduction.
That's true.
I don't think monkeypox is going anywhere, but if it is, the question should be why. There have been outbreaks and public health has had no issue controlling it. I agree. I think this is big. 5,000 cases is unusual, and I don't know the reason for that. It's curious. Do you have any ideas, Amy, why it's gotten so extensive?
No. But I also think we don't really know how many cases there are per year in Africa. And not everything came from Africa, because like some kid got it here, or some family got it here in the United States from what are the gopher thingies that live in the Midwest that
Prairie
come out
dogs?
of the holes, you know? Yeah, prairie dogs. But those are rodents, aren't they?
Mm-hmm. Let's check.
Mm-hmm.
They're not dogs, that's for sure. Prairie dog.
No, they're not dogs.
Squirrel family. Do you like squirrels, Amy?
From far away.
Gwen says, I was listening to the latest WHO. They don't seem to be pushing 4 doses, just more need to get vaccinated. Well, I think that's a great point, right? So a lot of the world is not yet vaccinated, sure. and we're pushing 4 doses. It's kind of crazy. I have no symptoms. Do I need to quarantine or test? What type? Well, don't do anything if you have no symptoms. No, you don't need any test. No.
On.
Thank you, Lisa, for your support of Microbe TV. Is a stimulator of neutralizing antibodies a good indicator the vaccine is targeted well?
No.
No, not necessarily. If T cells are important, then antibodies are not the right thing to measure. And I think that in the end, we're going to find out that T cells are really important, and we were barking up the wrong antibody tree. But it will take time for that to come out. What do you think?
Mm-hmm. For sure.
Older folks are vulnerable even if they are vaxxed. Absolutely right. It's a very vulnerable population. Yep. CDC strongly alludes BA.5 is escaping neutralization due to many spike changes, suggests masking. Unclear to me if current or past vaccination still protective, severe disease death. It is. It is protective. You don't need to mask if you're fully vaccinated. Do you think unreported and or unnoticed infections is making the vaccines appear less effective than they seemed when there were more naive people walking around? No, I don't think so. I think it's all about we're far out from the initial vaccinations, and the antibody levels go down, so you get infected. It's quite standard, quite straightforward. The issues you have with hospitalization data, how could these be improved if at all possible? Well, I think you'd need a definition, as Amy said, for why you're in the hospital. Is it because of COVID or with COVID? And what was the outcome in the hospital? How severe was the disease? Not just hospitalization, but some sense of what happened. And you may find that many people were hospitalized, but they didn't have to be. But I think ICU admissions would be a good one also. Okay, let's see. We have 4 minutes left, so let's see if there are a lot of questions, Amy. It's incredible.
That's great.
Isn't it great? Let's see if we have some
back next
people.
week.
Let's see if we can thank any more people for their contributions here tonight. Animal Party thanks you. They love you.
Yeah, I mean, I have to send her a picture of my virus of her virus painting in my office. But everybody loves that EVD68 in purple and green.
How do mask wearers deal with getting hair done? So I wore a mask for a while getting haircuts. And yeah, I
Yeah,
wear a
you just
mask.
remove the
She
ears.
cuts. She cuts, and then she takes one ear off and holds it and cuts. Yeah, it works. But then the last time she said, "You don't have to wear a mask," and I'm good at that. All right, let's. A lot of nasty stuff there, Amy, that you were looking at before, all removed
Excellent.
by our industrious moderators.
Excellent.
The masking thing is so confusing. Vincent says, "Don't bother if fully vaxxed," and yet that's
Yeah, what?
that's Amy and I's interpretation. We do not believe masking is needed for fully vaccinated people. But if you are older, and that's the population that will have more severe disease even when vaccinated, you could be careful. It's fine. Thank you, Ian, for your contribution. This is Ian of the Bluetti.
Fluetti? Ooh.
Ian liked the Bluetti video. I'm glad you liked it. Thank you for
That's
your
great.
contribution. Are the shorter incubation time for later variants due to a fast response from the adaptive immune system?
They're all the immune responses. Symptoms are due to the immune response.
I don't think. Do you think there's a shorter incubation time for Omicron, Amy?
No. You get symptoms because you have already primed your immune response and it launches, so it has nothing to do with it.
Okay, folks, that ought to do it for this little episode. I'm going to end it 1 minute short because Amy is really tired. And
I also want to fix my internet. I don't understand it.
yeah, so Amy's internet is not working, so I think she's been a little distracted with that tonight. So hopefully, if you need some help, we could Zoom tomorrow, and I'll help you out. Okay?
Okay, I'll text you.
I want to
Maybe it just needs to be reset. I don't know.
Okay.
Plus, now I think it's thundering. I don't understand this weather. This weather is very confusing.
Sunspots. Thanks to all the mods tonight. Steph, Les, Tom, Vanity. Thank you so much for keeping some semblance of civility here. Eleanor says, go eat dinner, Amy. Did you eat dinner?
No.
Go eat dinner, Amy.
Okay.
And folks, come back with your questions. They're all great questions, and there are so many left. I'm sorry to skip them over, but it's time to go. And have a great night, everyone. We'll be back next Wednesday at 8 p.m. Eastern. And in the meantime, be safe and be curious. Good night, everybody. Thank you, Amy.
Of course. You're my pleasure. Good night.